This is the Cardiometabolic panel. This panel is a much more comprehensive look at cardiovascular health, metabolic syndrome, and diabetes risk. Now, cholesterol testing has historically been used as a standard of care for cardiovascular disease, where they look at the HDLs, I call them the happy, healthy ones, or the LDLs, the lousy ones. But it is actually not the cholesterol in these that's the problem. The lipoprotein particle subgroups and densities are what carry the cholesterol through the body, are really the responsible ones for the key steps in plaque production and cardiovascular disease. So measuring the total cholesterol and the HDLs and LDLs alone does not provide the complete picture and can be very misleading. So what we know is that up to 50% of those who have suffered heart attacks had normal cholesterol numbers. And I've actually seen this in my practice. People come in with almost identical total cholesterol, LDL, and HDL numbers. And then when I look deeper into their particle sizes and densities, one person will be at high risk and the other is not. We also know that the lipoprotein particle is only half the cause of cardiovascular disease. So looking at inflammatory markers like CRP, homocysteine, insulin, and others completes the picture and gives me a comprehensive look at the causes and how to treat. So I also want to point out that insulin was in my list of inflammatory markers, and it's so important to look at here because insulin is very inflammatory. Most reference ranges are way too broad for me, and for most people, I want to see their insulin at 5. So looking at diabetes risk and insulin resistance is vital in creating a comprehensive diagnosis and personalized treatment. What I see over and over is that the glucose and hemoglobin A1C may be fine, but the fasting insulin and this other marker, HOMA, is creeping up and creating insulin resistance, or insulin resistance is starting. These are much more sensitive tests, which means we are catching imbalances earlier and we can be much more proactive in our health. This is why the Cardiometabolic panel from Spectracell is a cornerstone of my practice, and it should be done to attain a baseline for optimal wellness for anyone with inklings of high blood pressure, high cholesterol, being overweight, or anyone with any blood sugar imbalances or any family history of all of the above.